Well, as cases of the coronavirus continue to increase, Dyadic International is looking to produce a vaccine to stop the deadly disease. The company hopes to create the vaccine at a much lower cost and larger volume so that more people will have access to it. Yahoo Finance's own Angelique Kenlani, as well as Mark Emalfarb, CEO of Dyadic International, join us now with more. Mark, thanks for being here.
Thanks for having me.
Tell us where you guys are in the process here.
So we've spent the last 4 years working with the European Union in a program called ZAPI, the Israeli Institute of Biological Research, to develop a technology platform that turns DNA into vaccines and antigens. So with a cell line provider that we help speed the development, lower the cost, and make these vaccines and antigens potentially much larger volume, much lower cost, so we can treat the masses all over the globe. So
just to be clear here, you're not developing a vaccine yourselves. You would partner with vaccine developers to amplify production of vaccines when we get there.
Yes, we're actually working with several different companies on antibodies, therapeutic proteins, the Serum Institute of India for vaccines and antigens and antibodies, Sanofi, 5 other top 25 pharma companies. And we're in discussions with a variety of industry leading companies, institutes like the Israeli Biological Research, ZAPI and others, to help them, enable them to make the vaccine and or the antigen, and then also the antibody potentially, which is a treatment. So there's a cure, or not cure, but the treatment, which would be after you get it, and a vaccine, which would be to prevent it. So we're working on both sides of the equation and hoping to bring large volumes with low cost so that everybody can actually get access.
So, and you, like you just mentioned, you have partnered with Sanofi and others, and you're looking at the technology behind, better production of these treatments. So, can you explain a little bit about like what the technology specifically is? How is it that you're able to do, in fact, what you're saying, produce more at a lower cost than what's already out there?
Well, we spent 25 years in the industrial biotech business making enzymes for washing blue jeans, biofuels, et cetera. And we spent several $100 million between us, BASF, DuPont, Dyadic, Amoco Bioenergy, et cetera, Shell Oil, spent several $100 million to ramp up the cell's productivity, its capability to put DNA in it and produce mass volumes of proteins. And antigens and vaccines and antibodies are just proteins. So we made industrial proteins for these massive opportunities in the industrial side. And now we leverage that technology over the last 4 years. After we sold our industrial business to DuPont for $75 million, we applied this platform now to animal and human health, because we're also working with 2 of the top 4 animal health companies in the world. So it's not just about human health, it's about also companion animals, dogs and cats, it's about pigs, cattle, and chickens. So it's a platform. Pop in DNA, out comes something new, in large volumes at low cost. And so to us, you need to give everybody access, not just a few. And we can make things quicker, better, and cheaper, more efficiently, and hopefully we can actually prevent some of these diseases from spreading.
So you're working with Sanofi, so this is an international effort, and I'm wondering, you obviously have the World Health Organization, but regulators in each individual country. What's the international effort like? What are those conversations like with those stakeholders in terms of trying to get something out there?
Well, with Sanofi, we're working on a different program. There was a program earlier that was working on 7 different proteins, from vaccines to antibodies and everything in between. So we're in discussions with different governmental agencies in the U.S., for example. BARDA is looking at something to try to make an effort to do this. The Israeli government's looking at it. The European Union's looking at it. Different pharmaceutical companies looking at it. So they're evaluating our technology to see if we can actually help make it in larger volumes and at lower cost, and also potentially speed it up. So there's a lot of conversations going on in a lot of different rooms. We're very busy these days on top of our regular business, which is doing this for healthcare just in general. Now the coronavirus shows up, and in our case, we've been preparing for this pandemic and epidemics with, again, ZAPI with that program in advance. We've been working on getting ready to have a platform. So to me, it's not about just the coronavirus, it's about having a platform that can take the DNA that you need, the sequence, and make vaccines and antibodies for the future, because this is going to keep coming. This isn't the first, and it's not the last.
And obviously, the coronavirus is one of the top topics right now, so that obviously is something that would be of concern. Have you had any conversations with anyone who's working on a vaccine for the virus?
Yeah, well, we've had many conversations with people that have gene sequences that you need to make the vaccine. So you need to take that sequence, put it in a cell, that's where we come in, and then be able to mass produce that. So whether it's a antigen, the vaccine for the sort of prevention, or the treatment, which would be the antibody. So we've had discussions with both sides.
Awesome.
All right. We'll keep watching. Mark Emalfarb, good luck, CEO of Dyadic. Thank you.
Thank you very much.